I'm Ali Khan. I'm Dean of the College of Public Health, and I'm delighted to have, it looks like a half hour or 45 minutes with you to talk about the public health effects of climate change. Can everybody hear me? The back, especially the folks in the back. Okay, so this is working. Could we get that door closed? Thank you very much. Okay, so this is a small enough audience if you want to, okay, maybe this will, no? Okay, no. None of those options works. Okay. This one should work. Okay, I love this one. I love this one because, so how many people here read the Drudge Report? Let's be honest. No? The Drudge Report? Wow, one of the leading conservative sources of news in the United States, and I've got 2 people who raised their hands. Oh, it tells you something about my audience. Okay, so the interesting thing about the Drudge Report is every time it snows, they deny climate change. So right now there's this gigantic article about the greatest amount of snow in Chicago, I think, since 1940 or something like that. So climate change does not mean it will never snow again. Okay, let me just be very clear here. So I've got a couple of things I want to do today. But even before I do that, so there's going to be a very nice convergence of at least the the 1 o'clock session, the keynote speakers, and the session I just went to about what's going on in Nebraska. But what I wanted to share with you, even before I talked about climate change, this slide is almost 10 years old. So I got into the climate change business about 10 years ago when I was at CDC, at the Centers for Disease Control and Prevention, doing a lot of infectious disease work. And one of my interests was this amazing disease called Rift Valley fever that fortunately we don't have in the United States, but is a really big deal if you happen to be in sub-Saharan Africa, because it infects your animals, it causes them to die, it causes them to have abortions, and if you're in sub-Saharan Africa, you don't have a 401k. Right? Your wealth happens to reside in your animals. So this is a devastating disease for farmers, and it causes occasionally a serious disease in humans with bleeding and fever and brain inflammation and blindness and other things. But because this was such a devastating disease, it's very periodic, and so it's very hard to predict, but there's a good vaccine to prevent it. And so what happened and how I got involved in climate change was to try to look at climatic cycles over time to try to predict, based on satellite data, when do we think this disease is going to reoccur so that we could give a heads up to the farmers, yes, we know vaccine's expensive, but now is a good time to vaccinate your animals because we think it's going to happen. And so that's how I got into the climate change business about a decade ago, and I've carried this slide with me to remind people that climate change is now, today. It's not something that's going to happen in the next, it is going to happen increasingly in the next 20, 30, 40, 50 years, but it's happening today. And I always like to start out my talks, and I'll give you lots of more examples during the course of my talk, with 4 current examples that we see and have been seeing for almost the last decade that can't be explained by anything except climate change. So the first one is a fungal infection that belongs in South America that happens to be hanging out in Vancouver and causing disease in humans and animals in the Pacific Northwest. That fungus does not belong there. Showed up out of nowhere, happy-go-lucky, causing disease. Vibrio Para-Hemolyticus, this is a disease you get in oysters. And we had an outbreak almost a decade ago, again in the Pacific Northwest, because the waters were warming. And so these are oysters that should be good to go. Cold, when you think about oysters and infections, you're usually thinking Gulf of Mexico, right? It gets warm, the oysters get infected, and you get some sort of infectious disease from it. But these were oysters up in the Northwest, Pacific Northwest, that should not have been infected and were infected and caused an outbreak. Tick-Borne Encephalitis is a disease that occurs in Europe, and increasingly we're seeing those cases occur further and further north. Every year. Nice example of what's happening with climate and change in distribution of the ticks. And the last example is actually a good example. So respiratory syncytial virus, for any of you who have kids or were kids once upon a time, you were susceptible to this viral disease called RSV, or respiratory syncytial virus. It causes this little wheezing-like illness of kids. And what we're seeing across the northern hemisphere is that the time when little kids get infected is actually getting shorter and shorter. So this is a slide I've been carrying around with me for a decade now. So even before I talk about what's happening today, this is what I was able to talk about a decade ago about climate change. Okay, so I got 3 things we're going to talk about today. I'm going to talk about the science, and I'll talk about that briefly because that was done so well earlier in the keynote. I'll talk, obviously, a lot about the health effects, and then spend a little bit of time talking about what can you do to try to make a difference here in the state and make a difference across the United States. Okay, so you've probably figured out I'm from New York at this point. Am I talking too fast? Am I doing okay? Doing okay? Okay, slow me down if I'm going too fast. So the first comment I always get is climate's always changing, and that's absolutely right. Climate has always been changing. Here you can see an example out from 4.5 billion years ago about climatic changes, and there's lots of reasons climate changes, and you heard some of them earlier today, including about orbits and our orbital tilt. The point here is not that our climate is changing. The point is how fast it's changing in a short period of time, okay? And it's changing because of this. It's changing because of the marked increase in carbon dioxide levels worldwide, and you see the nice little lovely example there. Now, I want to remind you that carbon dioxide is actually a good thing, right? Some carbon dioxide and water vapor in our atmosphere is actually a very good thing. So if we had no carbon dioxide and so it makes up, the other thing I get is, questions I get is, well, carbon dioxide and water vapor, it's a teeny tiny percentage of the atmosphere, right? If you look at what makes up your atmosphere, 78% is nitrogen, 20% is oxygen, a little bit is argon. So there isn't a whole lot left, right? But that little tiny bit really makes a difference. So if I completely stripped out all the water vapor in the atmosphere and stripped out all the carbon dioxide in the atmosphere, our temperature would be minus 18 degrees Celsius, okay? So you really need the carbon dioxide and water vapor. However, do too much and you get increased warming. And what is the source of this carbon dioxide when I show you that large increase? Us, all right? That's 91% fossil fuels and cement, 9% land use, and then this is where your carbon dioxide goes. You heard earlier about land, oceans, and the rest goes very nicely up into your atmosphere, causing global warming. Excuse these builds. So climate change is happening now, right? Warming's unequivocal, physical and biological systems on all continents. We're seeing this increase in temperature. We're seeing this increase in sea level, and we're seeing this decrease in snow cover. And there's the data to prove it. This is from 2015 Lancet article. This, if it works, is my favorite way. Oh, yeah, it does work. Okay, so there's lots of ways to show climate change over time. This is my favorite. It's a spirograph. And basically, for every year, starting in the late 1800s, it shows you the increase in temperature by month. Okay, I think that makes the most, of any graph I've seen, I think that's the most powerful example to show you what's happened over the last 120 years in temperature. Okay, that 1.5 degrees increase. We can go past it. And satellite data, everything sort of supports that. So you can cherry pick small pieces of data to say, oh, there's no change here. But when you look at the data cumulatively, there's no doubt that we're seeing decreased Arctic ice, decreased ice thickness, and dramatic thinning of ice. And global sea levels have increased. I think you heard this earlier. And that's really, really going to matter if you happen to live on the coast. And I think you've already seen, everybody already saw this slide. I always like to give the Nebraska slide. That, we're talking about what's going on in worldwide, we're talking about what's going on in the US, but there's clear evidence of what the increase has been here in Nebraska also. And if you're an agricultural community, climate matters a lot. And this is the experience here in Nebraska with the climate change, with the overall warming since 1895 and the highs and lows that we discussed earlier. Okay, so before I go to humans, I got to go off a little bit on a tangent. I'm going to be honest, it's a little bit of a tangent, but I love frogs. Okay, so, and I make the point, and I use frogs, and I think I talk about birds and other things in a minute, to say that we are seeing real effects on species right now today. And one such species, or multiple such species, are frog species, where we're seeing population declines in Costa Rica, basic changes in where these species are and are not and what they're susceptible to. So these are real changes today that are related to climate change. Same thing's true with birds. I had I'm not sure if Dr. Rick Schneider's in the audience, but Rick gave a great talk in the last session about what's happening, and I didn't realize what the term is called. It's called an ecological disconnect. And so basically birds, many species, all species are being affected by climate, but they're not being affected in sync. So if birds show up someplace and the insects aren't there, that's not so good. And so this is what we're already seeing with birds, that they are migrating earlier, they're breeding earlier, there's polar shifts to where they're going, but unfortunately there's this mismatch of when they get there and where their food resources should look like. And then this was a example for anybody who likes your cod sandwiches like I do, what happened in the Chesapeake Bay, the Gulf of Maine, excuse me, where it was getting warmer than the rest of the ocean. People didn't really recognize that, couple that with some overfishing, and now basically the Atlantic cod stock has collapsed in that part of the world. And I'll spare you some lobsters and other slides to just basically show you that today we are seeing the effects of climate change. And I keep emphasizing the word today because often we talk about what's going to happen 20 or 30 or 40 years from now. But I think it's important to recognize what's already happening today because of climate change. And this is the final assessment by the Ipcc Climate Convention 2014. Everybody can read that faster than I can about how the systems are unequivocally warming. And the only reason I show this is for the bottom end of this slide. And what the bottom end of the slide is what it took to get a global community to say this, okay? So you can all understand if you're going to get 49 governments involved, 1,800 experts from 84 countries, they are only going to agree on the most narrowest definition of what's going on with climate in our communities, right? And so if you're going to put together this super conservative group to make a decision about what's going on and then they agree that there's climate change, then I think we should accept that the science is pretty clear that there's climate change. And even the Pope himself, who is a chemist, has told us that we need to do something about this. So it's not just a scientific issue, it's obviously a moral and ethical and social justice issue. Okay, now what I'd like to do is talk about the effects of climate change. And I'm going to give you an example. This is, again, out of the Lancet 2015 issue that did a really nice job talking about what the drivers for climate change were and what the various health outcomes were. And so what I'll do is I'll walk you through some of these health outcomes one by one and show you how they occur and why they occur. So the climate change drivers obviously increased temperature, precipitation extremes, extreme weather events, and sea level rise leads to a couple of exposure pathways around infectious diseases, food quality, and then the health outcomes. So let's start with the obvious. When I talk about climate change, the first thing that comes into people's mind is extreme weather events and heat strokes or heat illness, and that makes the most sense. So extreme weather globally, the number of reported weather-related natural disasters has more than tripled since the 1990s, and you can read all these faster than I can obviously chat with you about them. But we will see increased health hazards from extreme weather. And that especially includes heat-related changes. Now, I want to be clear, you know, when you're scientists, you need to give both sides. So yes, we will have less people dying of cold-related illness. Unfortunately, that's not going to be offset by more people dying of heat-related illness. And some of you will remember, you know, it's been less than 2 decades when we had these heat deaths across Chicago. Do people remember that? And Europe saw that less than a decade ago. So we still continue to have these episodes of these heat waves that cross our countries with significant morbidity and mortality. This estimate here is 38,000 deaths per year due to heat exposure in the elderly between 2030 and 2050. So that's the prediction for you there. We already talked about extreme weather events. Cyclones are another such extreme weather event that we were likely to see more of. And associated flooding. Okay. Now I want to take you to some examples that people usually don't think about right away when they think about climate change. And the first one is cardiopulmonary disease, heart and lung disease. Is not something that people immediately think about when they think about the effects of climate change. But when we talk about climate change, we're talking about the carbon dioxide, we're talking about particulates in the air, and then what is the impact of that on people. So here are premature deaths, premature death predictions due to particulate matter. And the interesting thing about this slide is not that it's going to continue to go up, that it happens now, today. We have people who are and this has been extremely well proven, that when you have these high particulate days, you wait a couple of days later and people are more likely to have their heart attacks and asthma attacks. So we see that happening already. And so the science for that is as solid as you can get, and then over time you'll see that will continue to increase, and these are sort of projections of where we are likely to see that happen worldwide. Ozone pollution, for example. And this shows you across the United States, based on what scenario you use, the increase in maximum daily temperature, maximum ozone, and the associated deaths with ozone in that graph. So you'll see this across the U.S., including parts of the mid-plains, which is us. We've already talked about this earlier, about the drier climates leading to increased forest fires. Okay, now let's talk about one that I've spent a lot of time on, which is vector-borne diseases. So vectors, and so when I say vector-borne diseases, I'm talking mosquitoes, I'm talking ticks, is what I'm talking about when I'm talking about vector-borne diseases, and I think in there somewhere I may throw in rodents and other things, but these are animals that infect humans and then they get infected with some sort of disease. And now all of these animals, and insects and mosquitoes, they are very susceptible to temperature and moisture. So it's easy to understand that if you're going to change that, you're going to see a change in the distribution of those animals. Not necessarily always bad, sometimes potentially good. So let's say you go to sub-Saharan Africa and it becomes so hot that there's no water left. Well, there won't be any people left either, but you're not going to have a whole lot of mosquitoes, right? Right, so I think it's important for us to remember that. But in other parts of the in other parts of the world, including the United States, you will see changes, yeah, without a doubt. So climatic factors just really disturb the distribution of these vectors. And okay, yeah, and that was essentially to line you up for this slide. Okay, so look at the distribution of Lyme cases in 2001 and look at the distribution of those Lyme cases in 2014. So just in 13 years, look at that dramatic increase. And I don't, let me see, do I have it or not? No, I don't have it. I could superimpose a different slide which actually shows you where the vector is, the tick vector that causes Lyme disease, and it's dramatically increased across the United States where this tick vector is. And besides this, I can show you examples with things like St. Louis encephalitis, a number of other mosquito-borne diseases, where when it used to occur in sort of the southern United States, and now it's sort of increasing farther north, and now we're starting to see this in Canada and Maine and other parts. So there's no doubt that we're seeing sort of this northern shift, a number of vector-borne diseases over the last 2 decades or so. So this is fast, very fast. And again now. Waterborne diseases. So I talked about flooding earlier, so it's hopefully easy to make that connection to flooding and then thinking about waterborne diseases and what happens due to waterborne diseases. Lots of microbes within water, bacteria, viruses, and protozoa. There's also some toxin. All of them likely to, some places increase, some places decrease, but overall increase as we think about what's going to happen to patterns of waterfall and increased precipitation. There's the estimate at the top right of 48,000 excess deaths due to diarrhea between 2030 and 2050. So real numbers, real kids dying of diarrhea. We talked earlier about increased rainfall across the Great Plains, and which will which will lead to our own pressure on diarrheal illness. And this, I want to thank Scott from the Lincoln Lancaster County Health Department who shared this with me. So this is our rivers and watersheds in Nebraska, and the little red dots are, it says so, nitrates. Okay, and this took me a while to sort of understand that there's so many of our rivers that always have these bans on fishing and drinking and swimming. And do I have mercury? I don't have mercury on this. There's a whole lot of mercury in these rivers. And I learned, this is new for me, again, I'm in the health business. Do you know what the greatest source of mercury in our atmosphere and our water is? Coal-powered plants. It was brand new to me. And I'm like, oh, okay. Well, that all sort of makes sense why all of a sudden all these rivers, if you look at them, you have this mercury contamination in them. So coal, our friend coal, is responsible for that. Foodborne diseases and nutrition. This one, all I ever have to do is show this slide. So this is the natural yearly distribution of foodborne diseases in the United States. So we see peaks. So when I was working at CDC, we always knew never to give the foodborne people the summer off, okay? If you want to take off, take a long Christmas holiday, okay? Because the summer was when we see our Campy outbreaks, when we see our E. coli outbreaks, when we see our Salmonella outbreaks. So all you have to do is you have to take that graph and just magnify it and think about what would happen with climate change if we had increased temperatures. And what you'll see is you'll see an increase in those bacterial diseases, and hopefully we'll see actually a decrease in norovirus, which is one of the largest causes of viral diseases in the United States. It causes of vomiting illness and usually people associated with cruise ships. Okay, and basically this sort of goes over the last slide. Some pathogens thrive in warm, humid conditions. They're laid out over there, and we should expect to see a whole lot more foodborne illnesses with increasing climate change. And let me end with mental health. This was also new to me. I've learned a lot because of climate change. So spikes in temperature and precipitation can increase the risk of personal violence and social upheaval. And there's actually really good data. So you know this concept of being hot-headed, or when it's hot, people's tempers flare? There's actually really good scientific data that backs that up. So there's and as you look at that data cumulatively, you realize that as we increase temperatures worldwide, we will see spike, not just in anger and other events, but generally in mental health events as we disrupt populations, people displaced, etc. So now we come to my favorite part, which is what can you do? And I'm going to change that from what can we do to what can you do? Okay. So I think the first thing we can do is we just need to accept this as inevitable, right? A 1.5 degree increase in global temperature. The earlier graph I showed you, that spirograph, right, that had already gotten to 1.5 degrees. And I realize there's this great desire to hold steady at 1.5 or not get to 1.5 according to the recent Paris Accords. But I think we've already bought that scenario at this point, and we just need to accept that and think about what are our mitigation strategies to take care of what the consequences of that 1.5 will be. The other thing that we need to recognize, and this comes easy as a public health professional in the social justice business, is that climate will not affect people evenly. It won't affect countries evenly, and within the countries, it won't affect people evenly. So some people, actually, depending on where you live, if you live in northern Canada and all of a sudden you can grow things you could never grow before, that may seem really cool to you. However, if you live in sub-Saharan Africa and you don't have any water anymore, that may not be so cool anymore. Right? So we need to recognize that these changes aren't going to be even, and as scientists, we need to be respectful of that and try to understand who is going to suffer the worst impacts from climate change. But what I can tell you already, based on what we see currently from those infectious diseases and those heat stroke and extreme weather events, these people are going to suffer the most, right? The elderly, the children, pregnant, postpartum women, people with pre-existing medical illnesses, they will disproportionately suffer from whatever happens with climate change in our communities. They're suffering. See, my students. So I always like giving these talks because my students throw all sorts of things into these things that I never realized. So I got to be careful. The worst thing they do is they mislabel Nebraska and see if I pick it up on a slide. So the public health response to climate change. So something that we don't have in the state that I think would be invaluable is we really need a good data repository of all the climatic factors, the atmospheric factors, and the health events that are going on in this community, and link them together and make sure this data then is available to the community writ large for their own purposes. It's really hard to drive policy without good science, and I think having a good data repository in the state would be the place for evidence-based policy to be derived, because you have that data on what's going on now, and as you continue to do monitoring for infectious diseases and environmental change, that sort of populates that database and can help drive what policies we need here in the state. We need to continue to model long-term ecological and epidemiologic data. We do need preparedness. So without a doubt, we need a climate change plan for the state, and I would say here for the city, we need to have a climate change plan. And this is not as big of a deal as it sounds. States and cities already prepare for all sorts of things, right? They have to, for various reasons. So it's just a matter of putting this in and including that in the hazard risk assessment that they already do to make sure that they're prepared for what those changes may look like in their communities, and then training and education of healthcare workers and public health workers. So I would like to make sure that our healthcare workers here in Nebraska are thinking about things that they don't see, Lyme disease, dengue fever, et cetera, et cetera. So they are, when they see a patient walk in the ER or their clinic, they're conscious of what's going on from a climactic standpoint that may make people at increased rate, heat stroke, whatever that may be. So training of those individuals. Now, I'm going to be very honest with you, since I've been talking about this for 10 years, which is that this is hard. Okay, it's very hard to communicate uncertainty, right? And it's very hard to help people understand that this is not just an energy issue, but it's a public health issue. It's very hard here it says the costs of not taking action are high. This is my daily business, which is, it's very hard for me to talk about prevention. It's a lot easier to talk about, I'm going to save that child with cancer, as opposed to I'm going to vaccinate 100,000 people with measles vaccine, so we don't have all these cases of measles. So it's a prevention model, and the prevention model is hard. Trust me, it will be a lot easier to get all sorts of interest for climate change when New York is underwater. We won't have any problem at all at that point, right? The way Venice now has, everybody's excited about Venice and Venice being underwater. It's too late when New York is underwater to say, you know what, maybe we should have paid attention to climate change. And so it's hard communicating uncertainty, and that's why I depend on people like you to help people like me who are in the science to say, Ali, this is the best way to think about it, this is the best way to frame it for our common individual audience so that they understand what we're trying to say when we say that this is a real risk and that we're seeing these issues right now. And I'm never, ever going to give a talk without saying what you can do, right? Let's see, do I? Okay. Do I have all of my sustainability folks? I see some of my sustainability folks in the back of the audience. Did I get this list right about what you individually can do? Okay, so yes, there are critical policy issues for us at the state level, at the national level, but you can individually take action in each and every one of these places to decrease your carbon footprint. You got some more?
I would add that you can talk to your employer.
Good one. Thank you very much. And you also shared earlier that Google has said that they're going to be carbon.
Next year they're going to be 100% renewable energy.
Okay. So you have the power then not just to drive yourself, you have the power potentially to drive the companies that you work in to make those sort of pledges. Okay? So regardless of what action or inaction may be going on at the state and national level, you have a lot of power to influence your own lives and the lives of the work of your communities and your businesses. And I will leave you with this slide. Thank you, everybody. I think we have a minute or two for questions, if anybody has a question. Are there microphones back there? Okay, so you're going to have to stand up and yell. And identify yourself, please. Thank you. That's a great comment about being locavores, so as much as possible. And that shouldn't be so hard to do in our state, right? We are an agricultural state. So besides climate change, there's lots of other drivers for infectious diseases. So the two key drivers, so let's talk about Ebola. So what happens in Ebola is that people get infected from animals and then they go to healthcare facilities that don't have infection control practices. And that sort of revs up the outbreak. And then we are no longer protected by the incubation period. So this is getting a little technical, but once upon a time, if you got sick and it took a couple of weeks to get someplace, we knew you were sick. But nowadays, you can go anywhere in the world in 24 hours, 24 odd hours, and you could show up happy as could be, right? And then you can transmit the disease. So that's what happens with Ebola. There's no evidence that Ebola is linked to climate change. And with Zika, what we saw with Zika is essentially inattention to mosquito control throughout South America. And the moment a new virus showed up, so they were not controlling dengue, they were not controlling yellow fever or chikungunya, and the moment a nasty virus showed up from Africa called Zika, it just spread throughout those communities because they had not paid attention to it. In the United States with Zika, we're seeing exactly what we thought we were going to see. based on other viral diseases like Zika, which is a couple of cases in Florida, and now I think we've had 2 cases in Texas or something like that, and that's what the expectation has always been. So that's not as big, not going to be a big risk. Zika is not going to be a big risk for the United States. What is going to be a big risk is some of the diseases like Lyme, which we already have, St. Louis encephalitis. There's a couple of these other diseases that we already have in the U.S. As the vectors start to move, will provide a greater source of infection for humans. Sorry, I tried to do my Epi 101 class in 2 minutes for you. But you can come to the College of Public Health and I'll give you the full course. Yes, ma'am.
I have been reading in the news that one movie, Cowspiracy, it talks about eating meat is a greater cause of a large, great cause of CO2, also some.
Excuse me? Yeah, some suggestion that methane associated with greenhouse gases. So I have to be clear with you. When I joined the University of Nebraska, I signed a non-disclosure clause that said I'm never allowed to talk about beef in any way, shape, or form. And I really love being in Nebraska. No, just teasing. I eat meat. Meat in moderation isn't going to have a dramatic effect on climate change. I think the bigger effect is what we're doing with coal and putting coal into our air. I mean, that's where we need to start in trying to have an impact.
Question about comparing these incidences of, it seems like asthma and allergies are increasing. Is it pollutants and even more severe than that? Is there any,
So there's definitely a tie with air pollution and asthma and emphysema. There's no doubt about that link. The clearest link with lung cancer is with smoking, but there are cases of lung cancer that aren't associated with smoking. Sir?
You talked about how got exactly the results you were expecting. How good are your predictive models, and then Askins, should we?
For Zika?
No. I'm just saying you seem to have confidence in your predictive models, right? Because you said you got exactly the results you expected.
For Zika, we got exactly the results we expected based on the distribution of the mosquitoes in the United States.
Okay, so I'm asking, are you confident about your other predictive models in that same way? And if you are confident in other predictive models, Askins at our doorstep has not been here.
Okay, so and so there's different models with different value for different pathogens. But what I worry about in Nebraska is, again, a lot more of the tick-borne and mosquito-borne diseases in Nebraska. And I would worry, as temperature goes up, some of those other effects. So we've talked about fires, we've talked about heart and lung disease, we've talked about heat risk, and the data that shows that based on whether you have a low increase in temperature or a high increase in temperature. So there are some pretty good models that show what the effects would be at not just at a national level, but at a regional level at least. And that's part of the preparedness stuff, is that for the state and the city to sort of examine those models and say, what are the risks that our population are at, and how do we make sure we mitigate those risks? Sir, Senator Har.
Yeah, in the 2014 Nebraska Rural Poll, people said they looked to health officials and doctors for climate expertise. Is there part of the formal education yet at UNMC, for example, climate change in the curriculum of doctors and health? Could you talk a little bit about that?
I'll be glad to. So we are at the University of Nebraska Medical Center, we are in the midst of completely redoing the medical school curriculum. And as part of the redo of the medical school curriculum, we will be talking more about climate change and what the impact of climate change would be on the diseases that they are likely to see as clinicians. And the same thing on the College of Public Health side, where we're gearing up for a new new classes in climate change on the College of Public Health side, so that people can sort of understand as they go out as public health practitioner what the implications are likely to be for them. And you're right, we need to make sure we have if people respect, actually they respect nurses more than doctors, I'll be very honest with you. So we better make sure we train the nurses too. But to be as good sources of information in their community. All right, I think, Lisa, you're last.
I'm a little new still in Nebraska, but I know that the Nebraska Medical Center is so well respected throughout the world. I mean, really, they are. And you guys are a gem to the state. My question is, does the administration there have a policy on advocating for that we need a policy on climate change? Do they kind of endorsement saying that we as a community of a state like Nebraska, that you would, that entity is an organization, we need institutions to come together also, along with us individual people. See where we're going with this? Do we have something like that somewhere, medical center?
So, was it last year or was it earlier this year? So earlier this year, the university and the medical school, the nursing school, the public health school signed on to a petition by the President Obama's administration about teaching people about climate change. So that was an official, I guess, an official endorsement of making sure that we are educating our practitioners about climate change. Thank you, everybody.